Hi, I'm Ginille, cosmetic nurse practitioner since 2013. I practice in Los Angeles. I've got 3 medical spas, 2 are in LA, 1 is in Las Vegas, Jossie Skin and Wellness, formerly Ginille Beauty Aesthetics. Focus on treating all skin types, all skin tones, getting in natural looking results for the patient so they never look overdone. They look like themselves. They looked refreshed. And we have great team members in our offices in LA, in Vegas. I like to get on and talk through any questions you may have about Botox, fillers, skin treatments, hair treatments, weight loss, wellness. Talk through anything here. If you want, you can invite yourself in. We can talk face to face, or you can set up some one-on-one time. We can do virtual consults or in-person consults. And so, yes, I've been doing it since 2013. I will go through any questions you have. I can talk to you about some of the main questions we get asked. I can talk to you about patient before and after photos, talk to you about treatments I have done. I'm probably going to be on here for about 20-ish minutes because then I got to go watch my child do his practice. Okay, so in our office, some of the most commonly performed treatments that we do are skin treatments. Everything we offer in our office is safe for all skin types, all skin tones. We have aerolase laser, skin pin microneedling, bio refill chemical peel, and hydrofacial. We have a membership program where our patients come in on a monthly basis, and we are picking and choosing the skin treatment that they get for the month out of those 4, depending on their skin goals, their skin needs, and that will help determine. With those treatments, we can combine them same day, depending on what the patient's concerns and goals are. So that is really nice. A lot of, like today, we had a patient come in and she did the laser, followed by the microneedling and the chemical peel. And then she did the all natural filler. So the all natural filler is probably one of the other main treatments that we do right after our skin treatments. All natural filler is made completely from your own blood, your body's growth factors and stem cells. When we draw blood, we spin it in the centrifuge, it separates out your growth factors and stem cells. We take that out and we heat it so it makes a gel. We can inject that anywhere in the face. Most common areas people like to do it are under eyes and smile lines, but you can do it anywhere. The goal with this is to make new collagen wherever we inject it. And so this is not as instant as you can get with traditional filler, but over time, things just look better. And it is like aging backwards because you're getting that new collagen in there. So again, if you have questions on any of these, please let me know. Or if you want to jump in the chat and talk with me one-on-one, we can do a consult here. So the natural filler, the patient came in and she did all her skin treatments followed by the natural filler. When we're doing these skin treatments, again, safe for all skin types, all skin tones, we want to really make sure that we're dialing them in depending on your needs and your goals. So again, we might be combining these on the same day, or we might be coming in just depending on what's going on. We treat a lot of acne, a lot of dark spots and hyperpigmentation. We've got hair removal, skin texture, just overall skin rejuvenation. So we do these things. The laser, I know somebody had mentioned to me talking about laser for black and brown skin, and is this safe? So aerolase laser, I mean, you guys, I totally encourage you to do your own research, but we use this laser in our office day in and day out on all skin types, all skin tones, on everyone. No downtime with the laser, which I love. And then it treats over 36 different FDA cleared indications. So acne, I think it works very well on. Hair removal, redness, those are some of the things where I'm like, I think this just shines. Overall skin texture and like glow, yes, it works really well. If you have acne scarring and there's like deeper scars, that's when I'm going to say, hey, I think we might be going more so with your microneedling combined with the chemical peel. Microneedling has a little bit of downtime where you're a little flaky and red. The chemical peel has minimal to no downtime at all. When I do the peel, I get slightly dry, maybe a teeny bit flaky, but it's not like sheet peeling, which is nice. Okay, let me go through and answer some questions. Hi, Dion. She said she's very interested. Please let me know any questions you have, Dion. Mrs. Jones said, what's my favorite filler? Depends on who I'm treating and then what area of the face I'm treating and what we want the outcome to be. One that I do grab a lot of is Radiesse. Radiesse is a calcium-based filler, mimics bone. So I like it in patients that have fuller, thicker skin. When I'm really trying to get like more lifting, I've had it all over my face. I haven't had any filler for the past 3 years because I'm breastfeeding and I've been doing the natural filler. But in the past, I've done like all the fillers, but I like Radiesse. I feel like it gave me the most like lift through my cheeks, through here, my temples. I liked. But again, the product, don't get so hung up on the product. Like, we got to pick the one that's going to be right for you based on your concerns, based on you and your face, how it's aging, and your just natural features. So that's one thing I don't want you to be like, I have to get Radiesse, because that might not be the one specific for you. Okay, Mrs. Joan, I'm trying to decide if I want to do PRF again or go back to filler. Ooh, that's a hard one. They're both so great, and a lot of patients will do both. If you want, so your filler, the thing with the filler is there's different ones that we can choose depending on you, your skin, areas we're treating. If I want something more structured, I might pick like something structured like Radiesse, or if I want something softer, I might want that for the lips, depending on the face. So I love filler, guys. I just have to use the right one in the right patient and make sure they're a good candidate for it in the area, and that they understand the limitations with the fillers. The PRF, I also love. Now, limitations there, it's going to be dependent on the patient. The healthier you are, the better the outcome. So I tell patients, I'm like, don't have a poor diet, smoking, drinking. If you're 60 plus, like, it's just harder for your body to make new collagen. Also, with the natural filler, it is not overnight. So that one continues to get better over time. So that is something to keep in mind. So Mrs. Jones, if you're like, I'm seeing these lines, it's totally bothering me, I need to get this line gone, or I'm seeing like volume loss and I want to treat that immediately, that's where you can go in with your traditional filler if you want more of an immediate. If you're okay, if it's not like a ton of volume loss and you're more trying to get ahead of it for, just trying to prevent, or it's like minimal, then I think you can go in with your natural filler, the one made from your blood. And when we do PRF, it's not just the regular PRF we're doing, a similar thing, but we take that and then we heat it and cool it. So heating and cooling it thickens it into a gel. So you're going to get a little bit more lift than the regular PRF, and your body is going to hold on to those growth factors and stem cells longer. So okay, Dion, do you have any places you recommend going to in Atlanta? If not, I can travel to LA. I would love to see you in LA. In Atlanta, Dr. Doan is there, and she has like really pretty work though. Biggest things I tell people, when you're trying to find your provider, look for somebody that treats patients that look like you. Make sure they're licensed and credentialed to do what they're doing, because that's very important. There's a lot of weird stuff going on, and you just don't want to, you don't want to mess with your face and get cement in your face, and then you have somebody that doesn't know how to take care of you. And I don't even know why they do that, but I've heard crazy things over the years from people. Look at their before and afters, look at their reviews. Make sure they can show you several patient before and afters, people that look like you. So that's something to like keep in mind. You want to make sure that they're treating faces that look like you. And then, do you like the way they look? Do you like the way they look natural, like themselves and their team? If they look a little crazy, they might think that's beautiful, and then they might think that's going to be beautiful on you, but you think it looks crazy. So how do they look? How do their patients look? How does the team look? Do a consult. Like, don't just trust any and everybody with your face. Don't rush this stuff, guys. I love Botox. I love filler. I love all the things I do. But I tell patients, I'm like, this is why I get on here and I want to educate. This is why I put videos out, because I don't want people making rushed decisions. Like, that's not my vibe at all. People are like, I just saw this and I want to do it like immediately. I'm like, hold on. I got to go through a bunch of questions with you. I want to make sure you understand it, understand the limitations, what to expect with it. Are you a candidate for this? Are you prepped for this? So don't rush these treatments. It's your face. That's something I would say. Dr. Doan, D-O-A-N. Okay, is PRF expensive? So we do it for $25.50 for 2 sessions, and you spread those 2 sessions a month apart. In our membership, it's a discounted rate for people that are coming in and working on their skin treatments. It's $9.50 per session. So yeah, people love the natural filler. I really like it. I think it's similar pricing to your traditional filler. When we do the PRF, we get usually about 5 syringes worth of product. And so we will spread that over depending on the patient. If somebody's eyes are super, super hollow and they're coming in for me to treat their eyes, I might be putting all of it underneath their eyes. If they're, sorry, I just like light is bright in my eyes. If they are, so it might be like 2.5 per side. It just depends on the depth of it. If their eyes are not super hollow, but they want to treat that and they want some collagen stimulation there, plus the smile lines, we might be doing some through here and the smile lines. When we're doing large areas, like when I did my temples, I did like 1 whole session just on my temples. When I did my chin, I did like 1 whole session just on my chin and like this pre-jowl area. So you don't want to spread it too thin or you won't really see the results. That's something to keep in mind. Okay, let me make sure I'm not missing any. How to lift hooded eyes. Hooded eyes. So if you feel like this is naturally laying low, non-surgically, what you can do is some Botox at the tail end of the brow. So you can do Botox here. It can help lift. It can help minimize the appearance of the crow's feet. This muscle around our eyes, a circle, orbicularis oculi, closes in. So when we Botox it, it'll help give a subtle lift. It's not crazy like that. If there's a lot of excess skin, you might want to consider a surgical consult. But people really like Botox brow lift. The patients that feel like, oh, they will tell me they know it's time to come in and get their Botox. It's worn off because they were like, oh, I can tell like my brows or my lids are not sitting as high, or it's harder for me to kind of see. And so Botox does open things up for them. Other things you can consider if you have a lot of volume loss through your temples. So sometimes this is sunk in here. When we put volume into the temples, it can help to give some support to this tail end of the brow. And it's not going to lift it totally, but it can give a little bit of a lifting effect through there. Can I still move my eyes if I do the tail? Yes, you totally can, AOL. You can do Botox here and you can still move and it'll be fine. Now, how much Botox you do really depends on how strong your muscles are in the area that we're treating, what you want the outcome to be. So some people will tell me, you know, I don't want any lines at all, like freeze it all the way. Other people will say, I want to have some lines, I just want them softened. So that's two different doses. Some people, when they smile, this goes really down and they have a bunch of lines. If they have more, like it would take more units to relax it. So the dose is really going to differ from person to person, and again, depending on their goals. Okay, let me see. I wanted to find my face, but not cheek filler because I have a round face. What can I do? Sarah, let me see if I can see your picture. I can't see. Oh, you're so pretty. I can't like see a big one. So if you feel like your face is round, when people feel like their face is round, this is me not like being able to see you and like assess your face. So I'll just talk to you. When people feel like their face is round, here's some of the things I consider. This is not saying every face should do this if they're round. I got to look at your face and kind of see what's going on. So sometimes if the face is round, what we'll do is some Botox into the lower face, into the jaw muscles. This muscle here, if this muscle is overused, it can start to make the lower face look a little wide. So when we Botox and relax it, it can make the lower face look a little slimmer. Sometimes I'll do some filler to the lateral part of the cheek to try to create a highlight so the cheek looks lifted out here. And sometimes we'll do filler into the chin and into the lower face so they can catch some light here. So they're not just like one round circle, but they have more of a heart shape. Those are a couple of things, but I just have to look at it. If the chin sits back from the side and it's like really short, putting filler into the chin can elongate the jawline. Again, give some light to the lower face. So this is me, Sarah, without fully being able to assess your face. Those are some of the things we can consider, but I just have to look at you so I can really know. Maria, oh my goodness, I was trying to add you to message you because I saw your message earlier when I was getting off with Ashley, one of our nurses. We were on live. And I saw your thing right before I got off and I was trying to message you. So you said, do you feel like microneedling and PRF is a preventative measure of having to get Botox in the future? So microneedling and PRF, microneedling, really good. Collagen stimulation, skin texture, fine lines, pores, acne scars, safe for all skin types, all skin tones. This is really good for your skin. Everyone can do it. There's a little bit of downtime. You're a little bit pinkish red and you might get a little flaky and dry. I would say about a week, 5 to 7 days of like downtime. And it's not like downtime where you can't go out. First couple of days, you want to keep the skin really clean. Microneedling is excellent. PRF, love it. So especially like when we're injecting it, like the natural filler for volume loss, for collagen stimulation, love it. Is it preventative of getting Botox? So not entirely. Like Botox is for softening the muscles. So people that I frown all the time, I got this, or I raise my eyebrows and I got these. So that is more like, even if you did microneedling, that can work on the texture. It could prevent like the lines from getting etched in. But if your muscles, if you're always just like looking at the computer mad, or if you're mad facing people all the time, like even if you microneedle, those muscles are still going to overpower. So you might want Botox. I don't know. It depends on how, some people will tell me like, I've never had Botox. And like, when I talk to them, they like, don't really move their face. Like they don't really like make hard expressions. And I'll say, hey, you don't really like express, like emote super hard. I'm like, oh, I've trained myself to do that. My mom told me to never do that. So they don't have lines. So I don't know if it's preventative from like having to ever get Botox. I think in general, it is like a great treatment to do for collagen, for overall skin texture, for keeping things looking great, like your skin looking lovely. But if you are like mad facing all the time, you still might want Botox later. So that's without me like seeing your face and watching how you express and whatnot. Okay, do you feel like one session is fine or getting all three according to the website? So are you talking about for microneedling and PRF? So any of these things, guys, it takes more than one, like realistically. I don't know how old you are. Again, if you're like young 20 and if your skin already looks good, you might not need that much. Like you probably do one and just like, oh, cool. But like any of these things, guys, just the way we get a haircut, just the way we get gas, just the way we do our nails. I mean, I don't, all the things take maintenance. The healthier your skin is and the better you're taking care of it at home with your skincare and avoiding the sun, like doing the basic stuff, healthy diet, hydration, the better off you are. If somebody comes into me and they've never done anything and they're like, my skin looks, I don't want to say like crap, but kind of, because they haven't done they're not using sunscreen, they're sleeping on their face, they're smoking, like all these things just kind of contribute to loss of collagen. They have a bunch of lines, a bunch of sun damage. Like they're going to take more treatments. So just something to keep in mind. Once I can see you or you can message me and tell me more about your situation or send me videos, whatever, text the number. I can really go through those. I can give you a little bit more guidance, but usually people are doing skin treatments at least like quarterly, at the very, very least twice a year. If you're like, I'm young and I'm 20 and I'm just fresh and my skin is perfect and I'm just trying to stay on top of it. But it just depends. And when people are really trying to work on a certain skin concern, we might be seeing them on a monthly basis. If it's acne, we might be seeing them, twice a month for a few months, like 2-3 months to like get on top of it. So everybody's treatment plan is a little different. I don't want to just be like, hey, this is the exact thing and just come and do this, because there's so much thought that goes into how we determine what treatments you should do and the frequency and blah, blah, blah. So obviously you guys see I talk too much. I need to answer these dang questions. Not dang, but like this is why we do consults. And this is why even for the people I've been seeing my whole career, my whole 13 almost years, every time they come in, we're kind of like, hey, where are you at right now? Oh, you lost a bunch of weight, or you're planning to lose weight, or, oh, like you didn't keep up with the skincare. You forgot to be using this, like any of those things that kind of switches it up. So this is why we talk a lot, to like figure out you and your goals, and like everything is going to be customized to you and what's going on. And you can have a twin sister and it can be completely different depending on lifestyle and all this stuff. Okay. Chin filler hurts. Somebody said, I love chin filler. That's one of my favorite things I did to my face. It's like hard for me to pick between under eye filler, chin filler, or temple filler as my favorite thing. I don't know. I mean, also filler or the natural filler. I've treated those areas with filler and the natural filler, but my chin was short, my under eyes were sunken, my temples were sunken. So I think all of those. Okay. How do we contact you? You can DM, but sometimes I miss them, just like being in with patients and whatnot. So there's a number at the top of my page, 424-218-4023. Text that. Like, it's a HIPAA compliant line. It's me and my team. I see all the messages that go through. These are not, like I said, HIPAA compliant. It's not going anywhere. Nobody's putting your pictures anywhere. You can send me pictures. You can ask questions and I can give you some responses there. Or if you want, also at the top of my page, you can set up a one-to-one consult, like virtually or in person. Or you can like jump on here and I can look at your face and talk to you like that. So, okay, Maria, 24, girl, you're just being on top of it. So, which is really great. Like, I wish I had started early. Basic things, Maria: sunscreen, retinoid, wash your face, like basic ones. Like, do the simple stuff forever. And if you do that, long term, your skin will be great. What is natural filler? Angelina was asking. So that is the one where we draw your blood. We make a filler completely out of your blood. Nothing else mixed inside the tubes. It's your growth factors and stem cells that we heat and cool. And wherever we inject, your body will make new collagen over time. You can put it anywhere in the face. It's not going to give the same structure or like lift that filler can get, but really good for volume replacement over time. The younger and healthier you are, the better the outcome. So our patients 20s to 50s really like it. 20s to like early 20s to like they're not early 20s, like late 20s to early 30s, they're doing like 2 sessions. When they start getting mid 30s plus, they're doing 3 sessions. And you want to retreat the same area, spread it about 1 month apart. Okay. What do I think about Sculptra? Sorry guys, I'm like going up and down trying to make sure I hit all the questions. Sculptra, and then they said, I'm 50 and I just need a little lift. Let me see if I can see your picture. Fashion, style, Sally. I can't see like your full face. So Sculptra is a really great collagen stimulator. If you have a lot of volume loss and you're like, oh, I'm feeling like sunken, and I'm seeing this and I want to see a more immediate result, filler. Sculpture is going to take time to build up, similar to your natural filler, for new collagen. If it's a lot of volume loss, I would probably put a little filler in there. Another consideration, besides the natural one or Sculptra, is dilute Radiesse. So Radiesse is a calcium-based filler, mimics bone. Read the research papers on it. It's really great. You can dilute it down and you can get the collagen stimulating properties. You can put this anywhere, same spot that you would do with Sculptra. You just can't put it in your lips and your eyes. And that can make new collagen, but depending on how much you dilute it down, like if you don't dilute it at all, it can give you a little bit instant lift. And then if you dilute it some, you can get more of just the collagen, like thin it out. So that's what I would say, Sally, but I can't fully see your face. And then just hearing more about your goals and how fast you're trying to see it and how much volume loss there is. Okay. Whoa. Let me go through these. Have you had surgery? AOL. No, I haven't. I'm nervous. My husband's an oral surgeon. I'm nervous about surgery. That's just my own personal. I'm sure it's like so great. I'm just nervous. And I'm like, if I can do anything to like not have it, I just don't want to be put to sleep. That's my only thing. I saw some movie where like this girl was put to sleep, but she was actually awake, and that was like trippy out to me. Price of Botox is $13 to $15 a unit in our office. Where do I purchase these products from? Straight from the companies, from the manufacturers. So we get them from Allergan. They are the makers of Botox and Juvederm filler. Galderma, they are the people for Restylane, Dysport. And then Mers, they're the company that makes Radiesse and Xeomin and Bellatero filler. Everything I do, guys, I'm not going to be out here risking nobody's face. Period. I'm not going to be doing anything shady. I'm not going to be out here risking my license. I went to Stanford. I went to Duke. Like, I got too much riding this. I've got providers. Like, I'm not trying to mess with anybody's livelihood, license, and nobody's faces. So anything we do, it's going to be the right way. Okay. Let me see if there's other ones. Somebody had said glutathione. I don't know much about it. So that's just I just don't know enough about it to tell you if I like it or not. I know one of the doctors I used to work with, he used to be doing the IVs when he was in the office on himself and he liked it. I just don't know enough. Okay. Would I treat someone with autoimmune disease, Gina? Yes, if I know enough about them and what's going on. When was their last flare? What is the autoimmune disease? Sometimes I'm like, hey, let's get clearance from your provider. But I've definitely treated patients with autoimmune diseases and they're like, look, I don't have any flare. Everything is controlled. I don't have to take any medications. This is super mild. It just depends. Now, if you're somebody that's flaring up and down, I'm swelling, all that, I'm like, no, let's not do that. Like, these things are all secondary. Do you recommend SkinVive in the lips? SkinVive is a like hydrator, like a skin hydrator. You can do it in the lips if you're just trying to like get a little hydration, not a lot of volume. Totally fine. I have dark under eyes, but not puffy. Some wrinkles too. What do you recommend outside of filler? The natural filler. So that's the one made from your blood, completely. It's nothing that I know is going to change the color of the skin. And so like, if I put some makeup on, if I do anything, guys, I'll put concealer there because even though I'm not sunken, I still have it just naturally darker underneath my eyes. A lot of people do. Some people that are brown, it's just darker skin there. Some people that are more fair, it's almost, you can see their blood vessels through. So I don't know anything to change the color. Wrinkling, you can, if it's like when you smile and you have some wrinkling, you can do a teeny bit of Botox, not too much, or it'll pull down your eyelid, like very, very light. Also at home, using your retinoid, that's going to turn skin cells over faster. Fine lines, pores, skin texture, collagen stimulation. So that's something to do. And use your moisturizer. And then skin pin microneedling or the bio repill chemical peel, you can do all the way up to the eyelid line and be totally fine. The laser, you don't want to get that close to the eye. But that's what I would say for under eyes. Okay. Does Sculptra cause skin to keloid? I have not seen that ever. Yeah, I just haven't. And I have not even heard that. Okay. Sorry. Last question. Do you feel that microneedling helps with amelia under the eyes? No, I don't know if that really helps. We have a black dermatology nurse practitioner on our team, Niani. Sometimes she can like get them. So she just has to see them. Under eyes, the skin is thinner. So you can send a picture to us, Maria, or come see her. She's excellent. Excellent. Guys, I'm just so extra. I don't want to be like, I'm excellent. That's not a nice word to say. Like, I'm not trying to be like that, but like, I just try everything to be the very freaking best I can. And that's the same with the girls that I work with. Like, I wouldn't bring them on to like, I wouldn't want to be dealing with a headache. These girls are excellent. Like, see Niani, she will tell you straight up if you can do it or not. Again, using your retinoid will also help. Okay, what procedure would that be? Talk to Niani about it. Let her see it. Let her see. Sometimes she can just go in there and like get them off. Sometimes we hypercate her, but let her, I don't want to be talking out of my lane. Let her see that. Okay. How much is consultation? Hey T, I'm in Vegas and interested. Oh yeah, so guys, we have our 2 locations in LA and then one is in Vegas on the Summerlin side. Consultation, so you can do it here. It doesn't cost anything. If you want to like jump on, you can do this, or I'll answer questions if you just want to type them. But here people will come on, they'll show me their face. Or to do the virtual consult, it's $150. The $150 gets applied to your treatment if treatment is done within 3 months from our consults. In-person consults are $350, and that gets applied to your treatment if you're doing treatment that day. So we like to do the consults to go through your questions, your goals, tips on what to expect, how to prep for treatments. When our patients come in, they're already like, we've already established a relationship. Like, they already have been prepared for this appointment because we've gone through some stuff. We've started building out the treatment plan. And like, I've been doing these virtual consults. I started doing them in 2020, or 2019 when, wherever shutdown was. And so I've been doing this for a long time, and my team as well. And like, we have a pretty good idea just going through the conversations and like being able to see your face or pictures to give you like the recommendations that I say, hey, in person, maybe this will slightly change once I can like feel on you and see how deep something is. But the consults were able to cover a lot, and get you like doing all the stuff you need to do before you come in for treatment. So that is super helpful. I'll be in Vegas on the 14th. I go once or twice a month and I see patients for like full facial balancing, but the team is there and they're seeing patients every day. Samantha's excellent. She also does virtual consults. She's a Black nurse practitioner there. We've got Alexis, great injector, and then we've got Karina, who's an advanced esthetician. And so definitely like love to talk to you, or check out check out the team in Vegas. They're amazing. Okay, for hollow under eyes, Lotus, I think you're asking me what to do for hollow under eyes. For hollow under eyes, you can do filler if you're a candidate for filler, or you can do the natural filler. Filler, so anyone that feels sunken, hollow, deep set, like that, that's when we're trying to restore volume. Your filler is going to give you an immediate result, like going to give you an instant lift. Now, you want to make sure you don't cry a lot, you don't have bad allergies, you don't swell. Anybody that retains a lot of water around the eyes are not good candidates for under eye filler, because filler binds water. So if you say, hey, I'm not a candidate for it, the natural filler we can do, where we draw the blood and we make the filler out of your blood, your growth factors and stem cells. Wherever we place that, your body will make new collagen over time. I'm going to have to go in a second because I want to watch my kid too. I'm excited to see you, Maria. Yes, please let me know if you have questions. You can totally text me. Let me make sure if there's I'm trying to see if there was any, what have I done on my own face? Oh yeah, let me pull that up. I've done all the things. Anything I'm telling you guys to do, I've done. So this is me at 28 before I did anything. I'm now 38. I have 3 kids. I gotta go watch the oldest, actually starting 11 in like 2 days. And so this is 10 years ago. I was breastfeeding. I breastfeed all these kids. I'm breastfeeding one right now. He is 2. And when I was like breastfeeding, I got really sunken here, my cheeks, you can see like dimpling, all the spots. So I did filler underneath my eyes. I've done filler in my temples, my cheeks, my chin. I've done all the skin treatments. And I really love the Bio Repill. I've been doing that one a lot recently. I've also done the natural filler. So since I've been breastfeeding this baby, I can't do traditional filler. I haven't had any regular filler for 3 years. I've been doing the natural filler. When I first did it, I was like, I don't see any change. This didn't do anything. Over time, I was like, dang, I don't look like this. I didn't revert back. Like it is nice. It has helped me not be so sunken, not be so hollow. And I'm 38 now. Like I'm a lot older. Okay, let me see. How long does that last? The natural filler. So Sharon, your body is making new collagen. We are losing collagen, like starting in our mid 20s. Once you make new collagen can last for years. We do keep aging. So we're also trying to do regular lifestyle things that are basic that I know we all know. to maintain collagen. So collagen keeps the skin looking lifted, like some volumized, it's like the structural support. Simple things, wearing sunscreen, having good hydration, good nutrition, not smoking. Those things are going to help you not break down the collagen as fast. Other things I've done Botox, frown, forehead, around the eyes, temple, like my whole face. I've done bajillions of units of Botox. People always like, oh, but I'm like, nice, you can move your face. It's not going to be that big of a deal. I have done, and the skin treatments. I really think the skin, guys, like when I just think about our patients and even my own self, I'm like, once the skin is nice, like everything is better, because it's like, I can do some filler on you and like get all the hollowness away. But if the skin doesn't look good, that's the first thing everyone sees. And then it's like, well, they got filler, but their skin is crap. Like, you don't want that. So I tell patients, I'm like, really work on your skin health first and foremost. And then, once we get all the highlight and the snatchness of all that, like, yes, that's cute. But like, if your skin does not look great, it's not nice. Like, the filler stuff doesn't even matter. How long does Botox last? Usually around 3 to 4 months. It depends on how much you're doing. The more you do, like the more units you do in a single session, the longer it lasts. But the more like restricted or frozen you are, the less you do. So some people, I'm in acting, I'm doing lighter on their units. It wears off a little bit quicker. Well, usually around 3 to 4 months. So people are doing it a few times a year. Okay. Someone said, she said, thank you. You've turned 60. Start and feel like it's time. Yeah. And then like for people, I'm just like, all of this, I'm like, do it when it bothers you, if it bothers you. And I either tell people, I'm like, I don't want Botox. I'm like, dude, don't do it. Like, I'm never trying to force somebody to have Botox. That's not it at all. If anything, I'm going to tell you to wear your sunscreen just because I don't want you to have skin cancer at the very least. But, if you don't care anything, people are like, I want to just age how I age. I'm like, that is totally fine. Like, power to you for whatever you want to do. Do what makes you feel good and beautiful, and doesn't matter what anybody else thinks. But if you want to do this stuff, I want you to make informed decisions. I want you to make safe decisions, and I want you to look good and natural and not weird, because we see all the weird stuff that's walking around the streets. Okay. And I don't want you to be like that. That's just not it. But sunscreen, Maria, I love our Jossie one, and we have a tinted one. I'm not wearing it right now. Today I had the non-tinted one, but they're both excellent. I like the tinted one if I'm like filming, and it just gives me like the littlest bit of glow, but I like that one. Skin treatments, Flaws for skin of color, Aerolase laser, bio repeal chemical peel. I love the peel. Even my husband, and he's always like, I don't see any change. He keeps asking me to like redo his peel. He really likes it. Skin pin microneedling, a little bit of downtime with that one. The laser and the peel, almost like no downtime at all. Hydrofacial, those are safe for brown skin. You can treat anything you're trying to treat with a combination of those. And we treat all ages, all skin types, all skin tones, all the colors. We do all the things. Aziza, thank you. I hope you're doing well. God bless you. I'm 28. Is that too early? No, I was 28 here. I'm 38 now. I did the stuff. I mean, like, no, like usually late 20s, early 30s are when people will start to see some signs of aging. And these are things like only you will probably notice at that time. And like your friends and family will be like, what are you talking about? You're being crazy. Like you don't have any, whatever you're noticing, lines, because it's so minimal. But you start to see like the fat pads starting to separate, like little things. And so when they're coming in and you're that young, that's when we're doing more preventative. Like we're doing the natural filler. I'm like, I love filler, guys. I'm like, if you can just do the natural stuff and work on collagen and keep your skin healthy, that's going to be the most important. I look so young. Thank you, guys. I was on this live the other day. Some boys, they were like 20. They were teaching how to do, I don't know, TikTok shop. I was listening to them. I was asking them because I want to put our skin products on here. So I was asking them, and they were like, hey, like, you want to go on a date, Botox? I was like, I'm 38 with a husband and 3 children. They were like, what? You're 38? I was like, okay, thanks. But anyway, read my comment. What is it, Ariel? What did you say? After. She said after. I just got filler. Can I use my red light therapy? Yeah, you can. Try not to get super sweaty or hot, but just make like if you did it today, like don't give it a few days just so you don't increase your swelling. But red light therapy is wonderful. You guys can do that at home as well. But you want to do it, you got to do it a lot to help make new collagen. Okay, I am going to jump off of here. I appreciate you. I will try to come on this weekend. Seriously, if you have questions or if you're like, just look at my face, text the number. Like, send me the pictures. I will see it. Those photos aren't going anywhere. And like, what are the recommendations? You can send the DMs. Just sometimes I miss them. So text the numbers. I know I came on a little bit early, Frody, and because I was my son wanted me to watch his fencing practice, and I was like, oh, usually he doesn't want, but he wanted me to watch it, so I'm gonna go over there. So the number at the top of my page is 424-218-4023. So you can text your pictures, you can text your questions, but what is this, da 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 da, and I can give you recommendations. Or if you're really like, hey, I'm trying to do this, let's set up a consult and we can go through stuff. Almost everybody that we do consults with, they're coming in to see us as patients. However, here and there, I see somebody that are like, hey, Ginille, I don't live there, but can you give me an assessment? Can you give me some recommendations? And then I'm going to try to see if I can find somebody over here. That's an option too. But we see patients from all over, like out of state, out of country. So anything, please let me know. Am I still in Vegas? Yes. Danielle, I'm going to be there on the 14th. Also, people that are in Vegas or trying to get to Vegas anytime soon, we're doing a giveaway. I think we're announcing it we're announcing the winners on the 10th. So this Monday. And we're picking 3 people to get natural filler and then either the laser or laser or the bio repeal. And so you come in that day. So you're going to be picking 3. So if you're in Vegas, you just enter that, and then I'll see you there on the 14th. See me and the team. The girls are excellent, but I will be there soon. I appreciate you guys. Let me know. My under eyes are looking bad. 54 in December. So filler or the natural filler, and then your retinoid, microneedling, and or bio repeal. Depends on what's going on. But if it's sunkenness, hollowness, filler, or natural filler, I will talk the whole time, guys. My husband has started to get on to be like, get off of life. I just like talking and going through and connecting with you. And then I meet a lot of you on here. So anyway, I will talk to you soon. I hope you have a great night. God bless you.